We'll go now to our 120 agenda, Senate Bill 1107. This is making an appropriation for general assistance. We have the Department of Human Services.
The button stands and supports.
Okay, thank you, Pankaj. We have anyone else wishing to testify on this bill? Okay, any questions? If not, we'll go to Senate Bill 1106. This is relating to for Senate Bill 1107, Focused, and Bridge to Hope also supports this measure for general assistance. Senate Bill 1106, this is the Medicaid Managed Care Program. It amends the Quest and Quest Expanded Access references in HRS and inserts instead Medicaid Managed Care Program. We have Department of Human Services. Hi, Rachel. Director Wong.
Good afternoon.
Good
Chair
afternoon.
Chen-Oakland, committee members. I'm glad to be here to represent our department.
Yes,
First hearing.
First hearing,
Yes.
yay.
Yes. Just wanted to provide brief comments. With implementation of Quest integration on January 1st, Quest and Quest Expanded do no longer exist, and so that necessitated the change in names. Wanted to be upfront and share with you that while reviewing the statutes that were related, we found that one of our guidances under the MedQuest division wasn't in compliance with the statute, and so that has been revised, and so now it's going to be at least aligned.
Okay, in this bill.
Yes.
Yes, thank you. Okay, wonderful. The next person to testify is Hawaii Community Pharmacists Association. Kevin Glick is in opposition. We have Farm Research and Manufacturers of America, Pharmaceutical Research and Manufacturers of America, William Gould.
We stand on our leading testimony opposing Section 7 of the current draft that deals with prior authorization procedures.
Could you please come forward? Is there anyone else wishing to testify on Senate Bill 1106? Okay, Rachel, could you also please come forward? Can you explain a little bit more the concern that you have in Section 7, and then I'd like to have Director Wong respond to that concern.
I guess the concern that pharma has is that with respect to accessibility of medications for these types of conditions, I think with the pre-authorization procedures and limitations, it dissuades and to a certain extent prevents some of these recipients from receiving the drugs, or at least applying for those drugs that would be that they would need in order to take care of their medical needs. So that would be the concern.
Okay. Are you seeing the change in the name somehow scooping in new?
I don't think pharma has an issue with respect to the combination of the names. It's only with respect to the application of the prior authorization procedures. Because currently, I believe Quest is subject to prior authorization, but Quest Expanded is not. What this bill does, is to make both programs or plans subject to the prior authorization. So pharma is opposed to that.
I see. Okay. Rachel, would you like to comment on that?
Sure, thank you. We're actually not changing any current practice. It's just changing the name to make it back to what we have been doing all this time. And as far as, related to new drugs such as Sovaldi, which treats hepatitis C, we're just following best guidelines, for efficacy and for effectiveness that show that pre-authorization really does help to follow medical necessity.
But is it true that Quest Expanded has no pre-authorization and now it will?
It currently does not because of that misalignment, that previous misalignment with guidance and with the current statute. Just since January 1st.
Okay. I guess how does that practically change things then from the pharmacist's point of view? Or
We have always we've always pre-authorized. And am I saying this correctly? We've always pre-authorized, and it's just in this transition from names that there's no longer Quest and Quest Expanded, that we've turned to Quest Integration, that there's just this interim time that there's been this not exemption.
I was just looking at the statute 346.
Maybe you can speak into the mic so that others can hear. Thank you.
In 346, 352, there appears to be a reference to the fact that Quest medical plans are specifically exempt as far as the exemption is concerned, but it makes no reference to the Quest expanded care. So that was my take on.
Because there wasn't, yeah. I'm gonna actually have our, may I? Have our AG come in,
Okay.
articulate this more clearly.
Sure. Leanne, could you please introduce yourself, and then if you could speak to that concern. Thank you.
Leanne Brewer, Deputy Attorney General. Yes, there is a change being made to HRS 346, 352, and the change from Quest to Medicaid managed care actually does expand the exemption, because under the current version of the law, Quest is exempt. So what the law does is it basically says that providers can prescribe in those three classes of drugs without prior authorization, but it exempts Quest. So Quest, under the current law, was able to impose prior authorizations. By changing Quest to Medicaid managed care, it does make the exemption broader, meaning it will cover more people. My understanding is the department at this point in time is not, in this interim period, is not changing their current practice, that basically the prior authorization would still continue to be done as they have been under the current version of 346 through 52. They would continue to impose it on those individuals who would be not age blind or disabled, or who would have been eligible for Quest. But since Quest does not exist anymore because the programs have been merged, you know, it's the practice or the continued practice of the department is not completely aligned because you don't have a specific population that's identified with Quest anymore. But what you can do is look to what the legislature intended by exempting Quest in the first instance, which was to exempt those individuals who are not age blind or disabled.
So should we make a statement in this bill that clarifies that?
It really depends on what policy the department, or the state wants to follow. The department, the Attorney General's office doesn't take a position on how far the exemption from this prohibition on prior authorization should go. My
So-
understanding is there is a particular concern about certain drugs that are very, very expensive, and it could be that there's another way to address that particular concern. But we do have an issue, with the fact that there's a reference to a program that doesn't exist. So something has to be done about that. But along with that, there is a separate issue about the types of prior authorization procedures that will or will not be allowed. And that might be something that needs to be further discussed on a policy level.
Okay. Rachel, I guess my question to you is, it sounds like you're assuring that there will be not a difference in practice. So I'm not sure if we would just make that statement in the committee report that says the intent of this measure is not to,
Change practice.
yeah, somehow we have to describe it a little better than that. I'm looking at Leslie since she's more with the MedQuest division. But is there a way to assure or address the concern that's being raised from the pharmaceutical?
So that should be first. Perhaps we can take some time to discuss this better so we can phrase it better.
Okay.
Yeah, it really was necessitated out because of, as Leanne was sharing, that, Quest doesn't exist anymore, so we're caught in this loop.
Okay. I know that the bill says upon approval, and that is what you, what department would like to see as the Section 10 language. And I know there's some timing issue.
Mhm.
Do you need to have this measure passed by a certain date?
I think out of this committee this week or early next week.
What is the end deadline, though, that the legislature has to act to send it to the governor?
I'm not sure. I know that the next committee has a couple hearings next week. So it's driven by the next committee.
Okay. I think for safekeeping, at least in the committee report, we should be quoting what you said, which is you are not changing the current practice.
Where we are right now, that's correct, Leanne, right?
Currently, the practice hasn't changed.
Right.
But if this passes, though, you're saying it will apply broader to more people in Quest Expanded?
Yes, it would authorize the exemption to be extended to,
The
all
aged,
of
blind, and
the-
disabled
right,
persons?
it wouldn't mandate that that be the case, but it would authorize that.
Okay, I don't know those implications yet. I don't want to be caught in a situation like in the late 1990s, more for the behavioral health, where there was pre-authorization and that jeopardized the care of the patient.
And
So
that's
we
not the
actually
intent of
carved
this.
out
Right.
some of that. Okay. By the end of this hearing, though, we'll have to make a decision if we're planning to move something out.
Okay.
Hmm.
Thank you.
Okay, thank you. Any questions? No? Senate Bill 722, this is the 30-day termination notice to be sent by certified mail or commercial delivery service instead of first-class mail. It requires a 60-day grace period to reinstate coverage under a lapse policy where cognitive impairment or loss of functional capacity is involved. We have the Department of Commerce and Consumer Affairs.
Yes, the department stands on written testimony submitted.
Okay, it says comments on this bill and that there's a lot of duplication with existing statutory protections.
That's correct.
Okay, thank you. American Council of Life Insurers, RN, in opposition, thank you. Peter Fritz, good afternoon.
Good afternoon, Chair, members of the committee. And I turn this off because I don't have to hear myself, but when somebody else speaks here, I have trouble with it. This bill has two components. Paragraph A essentially adds a component which requires that notice of termination or cancellation be sent by certified mail. As we all know, life's long-term care policies are not the kind of policies that if once terminated you can go out and replace at the same premium. It will usually be at a substantially higher premium. The reason for the certified mail is that there have been instances in other states where people have designated a third party to receive such notice. The insurance company said they sent it, but yet they never received it. And so in essence, this is a protection bill, but not just for the person who's a third party, because it's a protection bill for the insurance companies and a protection bill for the insurance commissioner should a question ever arise about whether or not a notice was mailed to an individual. There's an outside record, be it the mail, UPS, or FedEx. We should not have a situation where there's a question of having to prove, and the only proof of mailing is a computer printout from a computer company. We have enough experiences with the mortgage companies and fraudulent statements and fraudulent documents, and I'm not saying they exist here, but certainly the weight that used to be given to a document like that has certainly been reduced. So there is protection for the insurance company in these particular situations. And so under those particular circumstances, this was actually something that was brought up after I read an article about a similar case which arose in Virginia. And Virginia has changed their policy. When I spoke to the insurance commissioner over the summer about trying to do this by rules, they said, how many other states have done it? I said, I don't know, but I said, I'm admitted to New York, New Jersey, Florida, and Hawaii. And there's only one that hasn't done it, this one. And I've subsequently found that there are several other states that have adopted this additional protection. So, given that particular consideration, and I know that the department, the insurance department, I think it says that 60 days may be too long, but let's face it, somebody who's on the cusp of a disability, starting to lose cognitive ability or mobility, may not get down to their mail every day, may not be able to check it. And so that's why the 60 days is there. And I'll talk about things to strike and duplication in a minute. So, you know, I don't think that a termination of a long-term care policy should depend merely upon a written notice and a computer printout of what's being printed. There should be a little bit of assurance about what is happening because of the consequences. When we balance the consequences against the additional cost, they're significant. Now, with respect to changes of a proposed Senate Draft 1, the Department of Insurance is right. There is some duplication. There's another provision in the code talking about reinstatement if there's a disability for 60 days in advance, and that begins at line 9 on page 4. I kind of like having all the termination provisions or provisions relating to one another together in one paragraph. But in this, the insurance code is already there, and I don't disagree with it. And if it makes more sense for the insurance company not to consolidate everything together, why don't we just delete it, because it's going to cause opposition with moving this bill forward. The 60 days, I'm sorry, the 60 days, I believe, does make sense in light of the age and the type of people that are being protected under these policies. And that's on the previous page. But we can delete that additional language that's added there as well. The concept is to provide proof and assurance that the notices were actually sent when there have been instances when they have not been sent. Thank you for the opportunity to testify.
Thank you. Is there AARP?
Yes, Senator, we'll stand on our written testimony and support.
Okay, thank you. Michael Perrin is in support. Anyone else wishing to testify on this bill? Any questions? No? I guess I have a question for Oren and DCCA. I can understand the intent of this bill, especially for those that have policies and they're losing their ability to remember. So what provisions are protective of the customer or consumer at this point that this may be duplicative of?
I bring your attention, is this one?
Mm-hmm. It is.
Okay. In terms of reinstatement and in dealing with this vulnerable population, under 43110H210, there's a provision regarding a 5-month period during which, if there's a lapse in the policy, if there is proof of cognitive deficiencies or loss of functional capacity during that period, then the insurer, after the termination of the policy, the insurer, when provided proof of that, will be able to reinstate or can reinstate a policy, provided that previous or past premiums due are paid. So that's a quite lengthy period of time after the 30-day termination notice. So we're looking at basically a 6-month period after policy lapses that an individual may be able to reinstate with full benefits their long-term care policy. That's in specific recognition of this elderly population and some of the challenges that they face.
Is there a practice, Oren, currently for insurers when lapse occurs that someone physically checks on the person at all, or is it pretty much up to the customer to notify you, and if they don't have the faculty to do so, then it's kind of a catch-22?
No, with regards to there are really, two parts to this thing. First is the notice of cancellation, and then the other part is the lapse.
Okay.
When you get to the notice of cancellation, statute specifically requires that the insurance company provide notice that the policy will be canceled.
How much after not receiving payment does that occur, that notice
Well,
gets sent?
first of all, the notice of non-payment cannot go out until 30 days after the stated due date in the policy.
Okay.
That's the first thing.
So that's more like 60 days potentially.
That's correct.
Mm.
So what this proposes to do when you add the lapse part to it is that effectively, the insured is given 90 days. It also assumes that upfront on the due date, telling the consumer, the payment is due on this particular date, so please pay within 30 days of this notice. Okay. An insurance company by company has different policies in terms of how many notices are sent. But the law states with the minimum requirements. As a practical matter, I am informed that member companies of at least ACLI don't just give one notice. When it comes to the second 30-day notice, that's not the only notice that companies send. Again, by policy, companies give more than one notice. As a general rule.
Is there something that insurers ask of the insured that there may be another designated person
Yes.
that a notice can be sent to if there is no response?
Yes, if I might interject, our statute requires that there be a designated individual provided or named by the particular policyholder, and that if they choose not to name a specific individual, they must sign a written waiver. So under 431-10H208, that addresses unintentional lapses of policies.
I see.
So there are certain safeguards that our statute ensures are there to protect the policyholder.
Okay.
If I can
And-
chime in on that. I think the essence of the objections that companies have is that the things that the bill is trying to do, insurance companies already do.
Including the certified mail though?
Not the certified
Yeah.
mail.
So that's the only thing I see maybe is not duplicative, but
This-
may better serve folks, huh?
If I might
Yeah.
interject, there have been many discussions regarding certified mailing, and the NEIC model regulations regarding long-term care, they have, in the working groups, have addressed this particular issue, whether or not it should be in the model regs to require certified mailing for unintentional lapses and terminations of policy.
Yes.
But as that discussion has gone round and round, there seems to be insufficient evidence to support the need for the certified mailing. And in terms of Hawaii and the number of complaints we have received, the number is 0. As far back as, memory has served most of the individuals who have worked in the insurance division regarding complaints of unintentional lapse and termination based on non-notification by the insurer for long-term care policies. That hasn't been the case.
I can see though the demographics growing, and I don't know, what I'm seeing as a phenomenon is those that are designated are getting older themselves and may also be forgetful. So,
if may have-
yes, how does that?
First of all, certified mail does not guarantee that the third party or the insured are going to act.
Right, but at least there's some proof that they received it, because they have to sign for it, correct? Certified mail.
By certified mail,
Yeah.
yes, but there are considerations regarding certified mail. In my office, when I want to send certified mail, for me, it takes me forever and a day to do that. If you can imagine that you're an insurance company, you have to manually do this on every mailing. It can amount to a very expensive proposition.
Because you're saying there's a lot of folks that do not pay on time and lapse?
No.
Because this is only in the case where there is a lapsing or, wait, maybe I'm not reading it correctly. Is it lapsing or late payment?
It's
Non-payment?
It's late payment, I believe, is what the bill is saying.
The policy shall not lapse or be terminated earlier than coverage. So Peter, Is it for late payments or lapsing of the
Neither.
policy?
The reason why it was brought out was because an insurance company claimed that they mailed a notice. The third party that was set out to designate, to receive the designated notice claimed never to have received it. And in this particular case, it wasn't just 5 months, it was, he never received notice. 7 months after the non-payment and the notice would have gone out, his mother needs care, they had to sell all of their assets so she qualified for Medicaid. This is not whether or not they received the mail, this is a question of evidence and proof that they complied with the statute.
But
It
my
goes-
question is it upon lapsing or late payment? Because late payment is very frequent,
Well,
so that would mean a pretty burdensome
no.
financial
it's
cost.
not-
But if it's lapsing, what I'm hearing is there's not much of that. So the cost, I would think, would be minimal if we actually required that,
Well,
a
we'll get-
certified mail for
Okay,
lapsing.
if I can address your question in two parts. The first is that the notice is sent out upon non-payment indicating that the policy will lapse at a particular time. And that's when that notice is generated. This particular bill provides for notice by certified mail or to be sent by a commercial delivery such as United Parcel Service.
I just want to know for what prompts it, what triggers it,
It is triggered
for the
when
lapsing?
when a policy is supposed to lapse for non-payment, when all of the terms of the policy have been triggered, then that's when a notice would be sent out.
Okay, that's all I need to know. Thank
Thank
you. So Oren, with that in mind, I'm hearing that lapsing is not a frequent issue, so I'm just wondering how onerous or financially burdensome that requirement would be if I kept that in the bill.
Well, you're asking me how many notices of lapse actually go out. I can't answer the question to that in terms of how many lapse notices.
Okay,
But if you require insurance carriers to do that, my point is that there's a certain amount of additional cost that goes to that because the manual steps that are required in doing that. If you focus on the cost and the benefit and whether the insurer is acting promptly and properly, it's in their interest for a policy not to lapse. It's in their economic benefit to keep the policy
what
alive.
I understand, at least for Hawaii insureds, is that we have a very high rate of compliance and payment compared to the rest of the nation. So more than likely, if a policy is lapsed, it's because there is some kind of condition going on with them that they cannot remember, or that there is some kind of financial burden where that no longer makes it possible for them to pay. But so
If I may,
that is my understanding of Hawaii insurance. People here very rarely lapse their policies.
if I may clarify, when I stated that there have been no complaints of lapsing or termination of their long-term care policy based on not having received notice of such, that doesn't mean to say that they haven't been mailed notices and that they haven't lapsed on their policies, and then once they received notice somehow from the insurer that they then paid. If there wasn't any resolution, I think in that instance, we would have received or may have received a complaint, but we haven't along those
No,
lines.
I'm just remembering in '99 when we created a statute that required all employers to offer long-term care insurance, and what led up to that was, my understanding is people didn't lapse their policies, and back in those days, the insurance companies, many of them banked on people lapsing their policies. But Hawaii was a real good exception to that, and that was problematic for insurance companies. So
if there are no
we do
lapse-
have a minimum now.
So if there's no lapse policies, what does the public need to send by certified mail?
Because I already can see, just the demographics, and that a quarter of our population will be 65 years and older, and the percentage of people needing long-term care and the rate of dementia and Alzheimer's, all of that is being factored into I can already foresee a greater need or a greater incidence of policies being lapsed because of that cognitive condition. So that's all I see that value based on all of that information that I have gathered over the years. Yeah. So it may not be something that's critical now, but I can foresee already there being a problem. So I hope the insurance industry is thinking about that and not banking on people not remembering because of their condition, and then, you know, they don't have the benefit of the insurance policy.
That's addressing and creating a remedy where there is no problem currently. You're anticipating.
Right. Legislators should be foreseeing the future and anticipating things. So in order to prevent problems from occurring, this may be one instance of that. So it depends if you want us to project out that way or really be in crisis mode all the time. I don't think we are expected as legislators to be in that second kind of thinking. We should be thinking futuristically. Okay, any other questions? If not, Senate Bill 912. This is in regards to inflationary adjustment to long-term care facility prospective payment rates. Thank you. The first to testify is Department of Human Services. Okay, thank you, Leslie. Healthcare Association of Hawaii, George. How are you?
Good. Good afternoon, Chair.
Good afternoon.
Committee members. My name is George Green, and I'm the President and CEO of the Healthcare Association of Hawaii. Thanks for the opportunity to testify in support of SB 912. This provides for annual inflationary adjustments to the long-term care reimbursement methodology used to reimburse facilities for Medicaid recipients. Long-term care facilities in our state continue to face major financial challenges in providing quality health care to Hawaii residents, primarily due to the fact that payments for Medicaid enrollees do not cover the actual cost of care. We are seeking to have inflationary adjustments to meet the growing costs for providing care to this patient population, an important and growing patient population for the state. We understand that there are significant budgetary restraints that the state must move forward and operate under, but we do believe that this is a patient population that is deserving of having a healthcare industry that receives these inflationary adjustments to help them keep up with the cost of providing this care. Thanks for the opportunity to testify today, and we're available to answer any questions that you may have.
Okay, thank you. We have the Queens Health Systems. They are in support. Hawaii Health Systems Corporation. In support. Anyone else wishing to testify on this bill? No? Okay. I think I have a question for the Department of Human Services, Leslie. Currently, we don't have this component, and I don't think there is any obligation on the part of the department to report to the legislature, I guess, what the potential shortfalls are in the various providers that we contract with. Or do you think it would make sense for the elected officials or legislature at least to know what the challenges are when we don't have this kind of rate, or at least have calculation done that can be presented to the legislature for consideration, but not make it automatic?
We could, that is one of the things you could put in the bill. We could do that on a yearly basis. We'd have to work with the facilities to find out what their losses are.
And I guess I'd ask George the same thing. I think the concern always with the legislature is whether we have funding to really meet that increase, but do you think it would be valuable for the legislature at least to know what the losses are on a regular basis?
Yes, and we would be willing to work with our members and the Department of Human Services to provide whatever relevant information would be needed to do that sort of analysis.
Because I think part of the dilemma that we have, I think, for all these years is we see or we hear of shortfalls in different kinds of care settings, and we try to address it by emergency funding or what have you, but it's piecemeal. We don't have an overall kind of understanding of if we increase the rate of Medicaid, period, would that actually address all the hot spots or emergencies that come up every year? So I think maybe this is an opportunity to measure on a regular basis. And then from time to time, the legislature can consider an increase. So I don't know if I'm making sense to the staff, but Rachel, did you want to say something? Or Leslie?
Well, I think our concern is that we would like it to be addressed through the budget rather than have it in statute in terms of the increases.
Right, but maybe even not authorizing any increase, but to require DHS to report on, I don't know if it's annual basis or every so many years. Because I think what's happening is when we don't truly understand the impact by not increasing our rates, then providers stop even seeing our Medicaid patients, so we're paying for nothing and people are not seeing them. Somehow we have to have that kind of analysis on an ongoing basis. So I don't know how to modify the bill. I just kind of thought about that as I was walking here. How can we use this as an opportunity to build in that capacity? Yeah. Okay. Maybe George can think about it as an attorney.
We're happy to work on coming up with some language along with the department, so.
Okay. All right, thank you.
Thank you.
Senate Bill 968, this is Adult Protective Services. It appropriates monies for positions within Adult Protective and Community Services branch. We have Deborah Stone Walls is in support from Maui County. Rachel Wong, Department of Human Services. Mr. Kano, how are you?
I'm Elliot Kano, representing the Department of Human Services.
Yes, come sit down.
Branch. And on behalf of our director, Dr. Rachel Wong, we do appreciate the overall concept of this bill as it includes initiatives supporting our goals and objectives of the Adult Protective Services branch. But there is some concern that the passage of this measure may replace or adversely impact priorities indicated in the executive budget. However, any general funds appropriated will be consistent with the measure may be matched with existing federal funding for each position.
There is a way to match
Yes,
the funding,
yes.
and should we be modifying the bill to reflect that?
I believe the bill,
Right now, it has only general funds.
general funds, but the amounts, if I'm correct,
Reflects.
reflects 50%
Oh,
of the cost of the position.
I see. But if we were to put this, it may be that we could fold it into the budget in the long term. We have to know what that federal funding part is too, yeah?
And yes, and we have that.
I think that's very correct, because I think we would need the end fund ceiling to ensure that we can draw the federal funds down. So I think, and we do have the estimate for federal funds for these positions.
Okay, would you mind sending that so that we can have that inserted
Yes.
in the
Yeah, we
measure?
can do. We do have it. Do you need the number?
Yes, please. This is for the various sections.
Also FY 16,
Oh, you can just provide it
Oh,
to
okay.
us maybe,
Thank
and
you.
help us with the draft.
Yeah.
All right.
Okay, thank you. Okay, the next is Senate Bill 920. This increases the Medicaid reimbursement rate paid by the state to equal the Medicare reimbursement rate for primary and acute care. We have Rachel Wong, Department of Human Services. Leslie? Okay. Thank you. Hawaii Health Systems Corporation. In support, Hawaii Medical Association. Chris? Dr. Flanders?
Thank you, Chair Chunholko and Senators. Just real briefly, with the Medicaid program, the concern of the Hawaii Medical Association is with access of patients to physicians who accept Medicaid. And the experience that we had with the two-year program that was run by the Affordable Care Act was positive. We had, I'm not sure exactly how many physicians we had sign up for that. The last number I heard was about 1,000. So pretty good.
In Hawaii.
Yeah, pretty good. Nationally, we know that access improved that by about 14% for Medicaid patients because of the Medicare-Medicaid parity program. So it was effective, and yeah, we would support this bill.
Thank you. It's good to know. Queens Health Systems, Paula is in support. Bridget Reese in support. Anyone else wishing to testify on this bill? No? Any questions? Senators? Yes, Senator Riviere.
Department, please. I had a question. The concern is the additional cost, yes? Could you elaborate a little bit about that? I mean, the direct effect of this bill forcing that much money is going to throw everything else a kilter. What would be affected otherwise? I mean, the money's got to come from somewhere, right?
So, in the governor's executive budget, we have, requested, and it's included, in the budget for a total of 37 million, of which 17.5 million is with general funds, to continue the, increased reimbursements that Dr. Flanders had, referred to. Those, increased reimbursements were paid with 100% federal funds previously, and so that's why we are asking for this, monies to continue the payments to the providers. What we would like to do, though, with that payment is to spread it across more providers.
Okay.
So.
Thank you.
Okay, thank you for asking that, Senator. So there has been a governor's message sent down
It's in-
requesting the 37 million, of which 17.5 is general funds,
It's included in the budget.
in the previous administration's budget submitted to us,
Yeah, so it's currently in the
already there.
Governor
Oh.
Ige's budget request.
And does that equal 83.7% of the Medicare rate? What is the next paragraph you're saying?
So that would be if we were, if we got that funding, we would be able to provide the increased reimbursements to more provider types, basically.
But is it at the
So it would be at the
83.7%?
Yes,
Oh, that's good.
rather than the 100% that the few are getting right now.
And hopefully we'll be able to keep the new 1,000 doctors
Yes.
to help our Medicaid
Yes.
patients. Okay, so the goal at least is to try and preserve this in the budget document,
Correct.
our state budget bill.
Yes.
Okay, all right. So maybe this is not needed then.
We
Or
are
should we,
requesting
maybe
to
we
support
should
the
send,
governor's budget.
we should send this as an indication of that support. We can say in our committee report that we support the governor's request for $37 million, additional dollars, and of which 17.5, and that 83.7% of the Medicare rate is what would be funding our providers. Okay, thank you. The next is Nursing Facility Sustainability, Senate Bill 262. We have DHS. Leslie?
We stand in our testimony and support.
Okay, great, thank you. Attorney General's Office, Leanne? Good catch.
Thank you, Chair Chen Oakland. Leanne Brewer, Deputy Attorney General. I believe my testimony is pretty clear. We're making technical amendments to ensure that the exemptions of the nursing facility sustainability special fund from the central service expenses assessment and the administrative expenses assessment are preserved. And we've proposed language to make those corrections. My only point that I would want to make is that it's very important that these amendments be done this session, because the reason why those exemptions are at risk is because 3627, HRS 3627 and 3630 will be repealed and reenacted on June 30th, 2015. And so when that happens, it will go back into the form that it existed in 2009 prior to this special fund being included on the exemption list. So we need to make these corrections to ensure that those exemptions do not go away.
So the bill as drafted has an effective date of July 1st, 2015. But the act itself, June 29. Okay.
Yeah, the act.
So the
talk
way
about
it's
SB
written,
262?
it's okay.
Well,
The Section 6.
Yeah, what I did was, and actually, I made an error. My testimony refers to section, so did I make? I'm sorry, there's like 4 different versions of bills relating to the nursing facility and hospital sustainability programs, and we are trying to make the appropriate corrections in each. Yes, in this case, this act is effective on June 29th. Section 4 will take effect, Section 4, which is the appropriation, will take effect on July 1st, 2015, and this particular bill, the reason why I'm not making any amendments to, or suggesting any amendments to the effective date provision is because this bill, unlike some of the other bills that are on the table, does not make any changes to HRS 3627 and 3630, the references to those special fund names. But that is why the last paragraph of the testimony, I'm pointing out that there's this difference between the different bills. And so I would like to suggest that the legislature, there's 4 bills, as I understand right now, moving,
Yes.
that they be consistent in the amendment to the program names in both HRS 3627 and 3630. And I refer to House Bill 581, the method that they used for updating the program name, which also included a blank reference to the act that would hopefully be passed this session, would make it very clear for the readers, since these are not codified yet, what all the applicable laws are that define the program.
Okay, I think what we'll do is make sure that whatever the draft is, we send it to you to review one last
Sure.
time before I sign the committee report.
Okay, that'll be fine.
Where's Ty and Sean? Okay. Thank you.
Thank you.
Senate, anyone else wishing to testify on this measure? Healthcare Association? Good afternoon, George.
Afternoon again, Chair. George Green with the Healthcare Association. I'll stand on our written testimony in support of the bill, and we are supportive of the friendly amendments by the AG, and just want to say we appreciate the continued support of this important law by the Senate and the continued collaboration with the Department of Human Services in continuing this program. So,
Okay,
thank you.
Anyone else wishing to testify? Okay, we'll go to Senate Bill any questions, Senators? Senate Bill 276, this is the Hawaii Kupuna Trust Fund. Wesley Machida, Department of Budget and Finance. Okay. They don't support the creation of any trust fund which does not meet the definition of the trust fund and demonstrate capacity to financially self-sustain. Maui County Office on Aging is in support. AARP, Josh?
Thank you, Chair. We'll stand on our testimony and support.
Okay, thank you. Department of Human Services, Elliot?
Elliot Cano, Adult Protective Services. On behalf of our director, Dr. Rachel Wong, Department of Human Services, we do support the intent of the measure as long as its passage does not replace or adversely impact priorities indicated in our executive budget. But we will lend support as a co-lead agency along with the Executive Office on Aging and in selecting a department designee to serve as an advisory board member. So we do support.
Okay, thank you so much. Anyone else wishing to testify on Senate Bill 276? I'm just wondering, I know Department of Budget and Finance has had a hard time with the trusts being in their particular department. I just wonder if it should logically be in DHS or DOH, since the beneficiaries are kupuna.
Well, we, department do defer to the Department of Health regarding the administrative needs to execute this legislative intent of this measure.
So have you talked to DOH?
We
though?
haven't engaged in
okay.
discussions as of yet.
Because I know they haven't submitted testimony, so. I wonder, since the chair of health is here, if there may be consideration to put the trust fund in DOH. Is that too burdensome?
Not on me.
Okay,
Where's Ginny?
we'll talk story a little bit. Yeah, Dr. Presser's not here. But maybe for the sake of discussion, I think that would be logical.
It's okay.
Yeah.
I mean, looking for discussion, we still have some time to
Okay,
work out.
great.
Filter out the details, yeah.
Thank you. Okay, this concludes the actual hearing. We'll recess and then go into decision-making in a little while. We'd like to reconvene the Human Services and Housing Committee hearing. Chair would like to recommend for Senate Bill 1107, Emergency Appropriation for General Assistance, that we pass this as is. Any discussion? Okay, if not, Vice Chair?
1107 without amendments?
Yes, aye.
I vote aye. Senator Harimoto? Aye. Senator Rivera?
Aye.
Senator Slim is excused.
Thank you. Senate Bill 1106, Chair recommends that we pass this with technical amendments. This is the change in wording from Quest and Quest Expanded to Medicaid Managed Care Program. I would like assistance from DHS to have some committee report language that clarifies that the policy is still intact. Any questions, comments? If not, pass with amendment.
Okay, so this was the technical amendments
Technical.
on 1106, Chair.
Aye.
I vote aye. Senator Harimoto? Aye. Senator Rivera?
Aye.
Thank you, guys.
Thank you. Senate Bill 722, this is the long-term care insurance. Chair recommends that we pass this with amendments, striking all the language that seems duplicative of DCC, what DCCA has identified. We would like to keep in the certified mail language for now, so there is further discussion, and there is a technical change. Any discussion? So pass with amendments.
So Senate Bill 722 with amendments, Chair.
Aye.
I vote aye. Senator Harimoto? Aye. Senator Rivera?
Aye.
Thank you. For Senate Bill 912, rather than authorize inflationary adjustment for long-term care facilities, Chair would like to recommend that DHS, I don't know if on an annual basis, maybe every 3 years, every 3 years, calculate what the shortfall potentially is and be able to inform the legislature about those shortfalls. I don't know if it's through your annual report. Would that make sense, or should it be a separate report? It would have to be, if it's a statutory change, proviso, it would have to be done every year in the budget, huh?
Yes, I think that will give you the opportunity to look at it every year or every other year,
So through a budget proviso
perhaps.
in the budget bill.
Because our recommendation is to do it through budget.
Can't hurt. Let Wham take it out.
Oh, you still want to move on it with the inflationary rate?
No. But,
Just,
yeah.
just requiring that there be a report every 3 years on the shortfall of long-term care facilities in Hawaii.
Correct.
Okay.
Is that okay with you?
Through what mechanism though? Department of Human Services annual report. Okay. Is that okay, Kristen? Is that kind of a separate report on every 3 years? Okay, it should be a relatively short report. Okay.
Sure. I think the report should be written by the government relations person for AARP.
And HAH? No, actually George likes the idea. Of having a report so that we will know as legislators what the shortfalls are for the facility. But yes, it would be a responsibility of DHS to come up with that report. Okay. Any discussion? All right. So with amendments, Chair. Vice
So
Chair.
912 with amendments, Chair?
Yes, thank
I vote
you.
aye. Senator Harimoto? Aye. Senator Rivera?
Aye.
Thank you. Senate Bill 968, this is Adult Protective Services. I would like to recommend that we pass with amendments reflecting the federal dollar amounts, if Pankaj or someone, Leslie, can provide that information. So pass with amendments. Chair, Vice Chair?
With amendments on 968, Chair?
Aye.
I vote aye. Senator Harimoto?
Aye.
Senator Rivera?
Aye.
Thank you. Senate Bill 920, this is Medicaid reimbursement rates paid. Chair recommends that we insert HMA's amendments to include obstetrics. And also to put in the committee report that we support the governor's request for the $37 million, of which 17 point whatever dollars is general funds. And that will keep the rate at 83.7% of Medicare.
Could be worse.
Yeah, so one point is that it might change it. With the addition of OBs, we can't guarantee that it will be the 83.7%.
Okay.
Should we include it or not?
Yes.
Include
Okay.
obstetrics?
My feeling is OBGYNs are now primary care in the models that have been proposed, and
I think
so,
we just can't put the 83.7.
Okay.
yes, so that number could be adjusted. Okay, but that, we'll know that by the end, we'll get the numbers.
So in the committee report, we'll say without obstetrics, it would be 83.7%, but we still need to calculate if obstetrics is included at the end, what that Medicaid rate would be. Okay. Is that clear enough?
Yep.
Thank you. Any discussion? If not, Vice Chair?
Okay, so this is with amendments on 960, Chair.
Aye.
I vote aye. Senator Harimoto?
Or 920, actually.
Oh, 920, did I say something different? 960?
960.
I meant 920.
Mhm.
Yes, so again, 920 with amendments, Chair.
Aye.
I vote aye. Senator Harimoto?
Aye.
And Senator Rivera?
Aye.
Thank you.
Thank you. Senate Bill 262, this is the Nursing Facility Sustainability Program. Chair recommends that we pass with the Attorney General's amendments and to make sure that we check with Leanne Brewer with the final draft before I sign the committee report.
Did we pass this one already? Although I'm down with passing it again. This is number 2 on this, yeah?
No, not, that's hospitals. This is nursing facilities.
Right, yes, okay.
Mhm.
All right,
Okay.
good.
All right, so Chair recommends that we pass with amendments.
With amendments on 262, Chair.
Aye.
I vote aye. Senator Harimoto? Senator Rivera?
Aye.
There we go.
Great, thank you. Senate Bill 276, this is vulnerable adults creating a Hawaii Kupuna Trust Fund. Chair recommends that we designate, instead of Budget and Finance, the Department of Health as the keeper of the trust fund. And there are technical amendments as well. Okay, so it's passed with amendments.
Okay, on 276 with amendments, Chair.
Aye.
I vote aye. Senator Harimoto? Aye. Senator Rivera?
Aye.
Okay, wonderful. Thank you, everybody. This concludes our hearing.
Sorry about that confusion with the bill. I was